right, you guys. So we're going to jump into a brand new lecture series. This is going to go into a bunch of different diseases, things that we need to understand when it comes to taking care of our patients that come into the hospital. So some of the things that we're going to be covering are the etiology, the pathophysiology, the clinical manifestations, some of the diagnostic tools that you'll want whenever these patients come in, just so that we can truly identify what's going on. And then once we do have a really good idea of what's going on, we're going to have some treatment plans. So this first lecture that we're going to do, or this first series that we're going to jump into, we're going to jump into pneumonia, fungal, and abscesses. So all the fun things that are icky and gooey, just to get us kicked off. So here we go. So when we look at pneumonia and when we look at fungal and abscesses, what we're trying to do is we're identifying and establishing that there is some sort of bacteria or fungus or even virus that is causing some sort of infection in the body, and it's targeting and impacting the lungs. So when we look at getting a sputum sample on these patients, right? So we need to identify, hey, is this patient having a fungal infection? Are they having a viral infection? Or is it a bacterial infection? And what we do is we will do what's called a sputum sample. And when we get a sputum sample, we will go through this whole process. And if you take microbiology, you will learn about gram stains very well. And with gram stains, what we're looking at are gram negative and gram positive bacteria, we're looking at gram positive and gram negative. So the way I kind of remember it is purple is positive, purple is positive, negative is pink. So that's the way I learned it. And then when it comes to not looking at the color of the bacteria, but the shapes or even the morphology of those cells, we get this cocci shapes, which are circular shaped, and these can be in clusters, these can be in pairs, or they can be individuals, they can be in a line, just different descriptors that we have for cocci bacteria here. Yeah, the cocci bacteria with the the diploid cocci, and we have the cluster, we have the line, we have the tetrad. The next thing that we have is this rod shape. This rod shape is what's called bacilli. And again, we can have the pairs, we can have a line of them, they can be by themselves. So depending on what you see under a microscope and how the bacteria and the cells are shaped will help us understand what's going on. And then we have these other shapes here where we have like a spiral shape, we have a Y-shaped and a club shape, just different shapes that we have when it comes to the different shapes of bacteria. Now, I'm not going to jump into microbiology a whole lot, but for where we are and what you need to know, differentiating gram positive from gram negative, looking at cocci, bacilli, or other when it comes to the shape of that bacteria. So when we look at pneumonia in general, this is an inflammatory process that's affecting gas exchange units. So you can see here, these gas exchange units are just full of cellular debris. They've got red blood cells. They've got some inflammation going on, lots of different things, white blood cells that are there as well, T cells, helper T cells that are there, and they're trying to take care of or fight off that infection. That's what they are doing at the cellular level or in the alveoli. It is the 8th leading cause for death for Americans, which is crazy. There are so many other things that I would think that would knock out Americans. And when we look at our elderly population, so those that are older than 65 years of age, this is actually the sixth or leading cause for death. And when we look at worldwide, over 900,000 deaths are attributed to pneumonia every year. So to me, this is something that could be preventable. This is why we ask and we encourage our patients who are over the age of 50, 60, 65 if they want to get their pneumonia vaccine. And it's because of these statistics that it's the sixth leading cause for those that are greater than 65, and it's the eighth leading cause of death in America in general. So we have lots of reason for us to try to do everything that we possibly can to help prevent, identify, and treat pneumonia as quickly as possible. Other complications for patients with COPD or asthma, even smokers, they have more complications with removing all of that cellular debris and that infection, more so than those that do not have chronic pulmonary issues. And then other patients that are at risk are patients with heart disease, patients with diabetes, and especially those that are immunocompromised. Whether this is HIV or a patient that is a transplant patient, those patients get immunosuppressors. Even cancer patients that are going through chemotherapy and radiation, that therapy is designed to knock out white blood cells, and it puts these patients more at risk for infections. So causes, like I said, they can be bacterial, viral, fungal. You can have little protozoans or parasites. It can come from tuberculosis. It can be anaerobic organisms. It can come from aspiration or inhaling irritating chemicals. So all of these different etiologies are here in a list. When we look at bronchopneumonia, this is looking at the segmental bronchi, and it impacts both lungs and usually in the lower lobes. So if you have somebody that is diagnosed with bronchopneumonia, that's what we're looking at, is at the subsegmental bronchi and lower. And usually in both lungs, typically we see that in the lower lobes. When we look at lobar, this is confined to one or more lobes. So this is now starting to get a little bit more extensive. Here in this image, you have the left lower lobe with some of that left upper lobe getting impacted. And what's crazy is when you have the left upper lobe that's impacted, remember this fissure does not actually go kind of in this line. That fissure is kind of back behind the left upper lobe. And when you look at an x-ray, this entire x-ray or this entire left side will look whited out. Same thing with a CAT scan. You'll see that entire left side kind of whited out, especially with a left upper lobe pneumonia. So when we have that lobar pneumonia, especially in the left upper lobe, it looks like it completely whites out that entire left side. When we look at other classifications of pneumonia, you have Mycoplasma pneumoniae. This is a viral pneumonia that hits the interstitium. There's terms of walking pneumonia. This is a mild case of pneumonia. There's double pneumonia that happens bilaterally. There's healthcare associated pneumonia. This happens after a hospital admission. And then there's community acquired pneumonia, and that's from social contact outside of the hospital setting. So there's the another kind of acronym that we have for the social contact is community acquired pneumonia, or CAP. So that's another name that you might see with defining in a EHR or a health history. You might see CAP, and that's short for community acquired pneumonia, or HAP, that's hospital associated pneumonia. So just knowing that there's those different types. And we're going to talk about ventilator associated pneumonia here in just a bit, but there are a number of different names, if you will, for pneumonia. Now, when we look at risk factors, we already talked about etiology, and this is kind of what goes underneath the branch for etiology. So underneath the bacterial, fungal, viral, protozoan, all of those, you have kind of a separate list that's underneath that etiology that would be associated with risk factors. And you can see that there's 12 different risk factors here. We're going back into the immunosuppressive therapy for patients, patients that have or have had a transplant of some sort, patients with AIDS or HIV, cancer patients that are getting chemotherapy, prolonged bed rest, absolutely. So your patients that are in the ICU and they're not moving at all, these patients are at risk for pneumonia. You have even your endotracheal tube or your tracheostomy tube. I had a really good conversation with our good friend Respiratory coach earlier today, and we were asking about, like, why is it named ventilator associated pneumonia when, you know, typically it's patients that have an advanced airway, and should we call it endotracheal tube or tracheostomy tube or advanced airway associated pneumonia? So AAP something, I don't know. We were just having a good laugh about it. Anyways, you have lots of different risk factors that are here. Patients that are of the age of 65 years or older. Again, that is an increased risk factor for pneumonia. That would kind of go under the umbrella of etiology.